everyone, my name's Yassine and today I'm going to talk about stigma towards people with mental illness in the workplace. Let's get started. We'll begin with a couple of facts. According to the Canadian Mental Health Association, 1 in 5 Canadians will personally experience a mental illness in their lifetime. Also, few healthcare workers get the help that they need in a timely way due to barriers related to poor mental health literacy and stigma. This link at the bottom is just a really great introduction to stigma, and I strongly encourage you all to watch it and pass it on. When I typed the words stigma definition into Google, the very first example after the definition that came up was, quote, the stigma of mental disorder. So this just shows you how prevalent it really is. But the definition that appealed most to me was from the Cambridge Online Dictionary, and it goes, stigma, a strong feeling of disapproval that most people in a society have about something, especially when this is unfair. Here are some questions that will get you thinking about times when you may have been contributing to or impacted by stigma. I'll get you to pause the presentation here and just quickly read through and think about some of the answers. The two types of stigma are external and internal stigma. External stigma can manifest as negative judgments, opinions, comments, assumptions, etc. made by others about a person, whereas internal stigma is the internalization of external stigma, or a person's application of the judgment to themselves. The Canadian Human Rights Act states that all individuals should have an opportunity equal with other individuals to make for themselves the lives that they are able and wish to have and to have their needs accommodated. So this act implies that even if there is stigma towards a certain population, it's illegal to act upon these beliefs in ways that negatively affect any specific population or group. The Employment Equity Act basically applies the Canadian Human Rights Act to the workplace. It states that no person shall be denied employment opportunities or benefits for reasons unrelated to ability, and that employment equity means more than treating persons in the same way, but also requires special measures and the accommodation of differences. It should be noted that both of these acts were specifically applied to women, Aboriginal people, people with disabilities, including mental illness, and visible minorities. Each healthcare workplace has their own specific policies about discrimination, etc., but they have to abide by these laws. So what about when people don't realize that they're discriminating? Well, that's where awareness and advocacy come into play, but the takeaway message here is that you can't control people's personal biases, but what you can do is just try to increase awareness and prevent unjust actions. So let's talk about stigma in the workplace. Research shows that there are various programs to reduce workplace stigma, but there is limited research on which programs to use, when, with whom, and in what context. The current theory is that there is less workplace stigma towards mental illness in healthcare professions than there is in other professions. This would be explained by the fact that learning about mental illnesses and treatments is part of our training, and this results in a higher mental health literacy. So based on this assumption, it would make sense that programs tailored to healthcare professionals are a more appropriate intervention than programs designed for other professions or the general population. The outcomes of multiple intervention programs for healthcare workplaces were used to make an evidence-based set of guidelines on how to build the most effective anti-stigma intervention possible. This document can be found on the Mental Health Commission of Canada website. It's called Building and Delivering Successful Anti-Stigma Programs for Healthcare Providers. Specific protocols for existing intervention programs that can be implemented by employers have to be purchased. However, general tips on how to reduce workplace stigma from the perspective of various roles can be found on the Morneau-Chappelle website. Stigma can happen in subtle ways that are unexpected. It's not always obvious. For example, a recent study showed that people can feel stigmatized by the process of getting a fit note from a doctor, which is just the opposite of a sick note, but for the same purposes of enabling return to work. This study also showed that people preferred to get the note from their own GP who knew their history and understood them better. And finally, it showed that there are emotional barriers to return to work. This last point about emotional barriers was supported by a 2013 study that stated the added stigma associated with mental health issues further contributes to a person's emotional fragility and readiness to return to the workplace. Stigma is still identified as an issue in today's workplaces and is a contributing factor to employees not divulging their condition or accommodation needs, which can affect return to work success. It then talks about cognitive work hardening, which is just an intervention for internal stigma specifically. So anyone who's interested in learning about the details of cognitive work hardening, I encourage you to check out this article. That's all, folks. Thanks for listening.